Next part of this talk, we brought over from across a couple of different ponds, Igor Kozak, who was formerly in this fair city, is at the King Khalid Eye Specialist Hospital in the UAE in the vitreoretinal, and so I'll turn it over on clinical advances in retinal laser therapy to show us how you can do a PRP and some other things with this laser.
Good morning. Thank you very much. Let's just go over what has been happening with this technology. What is new and what is the advantage of having this Lamborghini of lasers? Well, it's precision because you really can plan your treatment and you know where you are treating and what you are treating. You could have also noticed that Dr. Clark made his plan and he completed it. So as you perform treatment, the screen will show you which spots have been hit and which you still need to do. That usually doesn't happen with regular lasers because you just go by what you see with your contact lens, and sometimes when there is a little cooperation with patient, you just give it up, so you may not treat fully. You know, here you complete 100% of your treatment plan, and you make your treatment plan with enough time to really think what you want to do. And at the end of it, you get all the information on what you have done. So, as Dr. Brown mentioned, the hope with this new technology and with everything that it brings is that we can decrease the burden of current therapies, which is injections in the eye. And I'm actually very happy to have him say that this is such a great technology, Lamborghini of lasers, and that we still need it. You know, him being a pioneer of what we know and what we do in intravitreal pharmacotherapy, so it means a lot, at least to me. So one of the first studies that had to be done was to evaluate the accuracy of the system, and he was just about right that with that movie clip that in about 60 to 70% you are right on target with your conventional photocoagulation. Now that brings it up to almost to over 90% when you do navigated image tracking and computer-guided treatment with Navilas. Subsequently, you can decrease the number of retreatments. So what frequently happens with regular photocoagulation that you need to bring patients for another session because you know, you haven't treated all that is there, or maybe some microaneurysms you either missed or you didn't see, or maybe they came up. So with this technology, you are actually decreasing the number of your subsequent retreatment sessions. Okay, and that has been studied and published by German colleagues. Now, another issue that happens with treatment with laser is pain, and the pain is actually comes from two sources, and it's contact lens and it's white light. So this technology, when we compared it to conventional laser, significantly decreased perception of pain in patients. And again, it's probably because there is you're using infrared light and you don't use contact lens at all, and you don't have to. Okay, patients, when you explain to them, they are usually cooperative, and in the end, it works very, very well. So the study that actually we were interested in doing is whether this laser technology can decrease the burden of injections that we need to use to get away or reduce diabetic macular edema. And there were two sites that ran trial simultaneously. That was a site in Germany, in Munich. And what happened, a patient with CME received ranibizumab injections, at least 3. Once the edema was reduced, then the patient received navigated laser, and then the patients were followed, and we counted the number of subsequent injections. There were criteria for rescue therapy, which is when patient lost more than one line of ETDRS vision, or central foveal thickness increased. So these are the results, and basically what is important is that there was an improvement in vision that is not unexpected, but when you compare the number of injections after Navilas treatment, there is a significant difference in the number of injections, meaning that you don't have to use as many injections once you have performed this navigated laser. And then there was another site that ran the trial with the use of bevacizumab, and it turns out that in Germany at that time you couldn't use bevacizumab, so they used ranibizumab. So again, the protocol was very similar: central foveal thickness, then reduced by initial series of intravitreal injections, followed by navigated laser, and then we counted the number of subsequent injections, and we did that both from at month 12 and then 12 months after navigated laser to get a meaningful data. Again, very reproducible increase in visual acuity in both arms, but this is the number of mean number of injections that patient needed after laser was performed. So again, and this is the proportion of patients who did not need any injection after macular laser, which is amazing that in close to 60% of those patients, they were injection free after they have received the laser for the duration of the study. So and here is a comparison of the number of injections needed across the trials, and we know there are problems with comparing the trials, but we can clearly see significant reduction of the need of subsequent treatments once this targeted laser had been performed. And again, these are data from both independent clinical trials. So in summary, this navigated laser, when combined, demonstrates improvement in visual acuity and reduced treatment rate, along with decrease of number of injections needed to maintain anatomical structure or function. So let's move on to further out in the periphery. So you can also do a navigated panretinal photocoagulation with this technology, and look at the view that you are getting when you do that. So again, when you want to achieve the same amount of field of view with a regular laser, you are delivering lots of white light into patient's eye, and that will be very problematic. So you can do that with Navilas because you can treat with the infrared mode, and you are just getting an excellent field of view. So that's better for orientation. And now you can notice that my monitor is on the left side of where I am. Dr. Clark used it in the right. So you can actually interchange it and tailor it according to which eye are you treating. And it's very ergonomic. You are basically watching your treatments as you do it. And again, a wonderful field of view here. And you perform pattern photocoagulation. Now, what is new is that you can perform 100 millisecond long duration photocoagulation, which is not possible with current systems. Current pattern semi-automated lasers use reduced short duration pulse. They use 20 or 30 millisecond pulse. So again, another patient treating far in the periphery with excellent view under infrared light, and well, this time it is 30 millisecond treatment, but the previous one was 100 milliseconds. So you basically can follow ETDRS, panretinal photocoagulation protocol, which is not what we are doing with current systems. Okay, so this gives you an extra armamentarium to basically follow what people have been doing for years, but you can do it in an automated fashion. There is pre-positioning, and again, see the view that you get. The treatment is pretty fast. There is a little bit of learning curve placing the lens, because for PRP you do need contact lens. You don't need it for posterior pole treatments. For this one, you need it. Once you lock in your view, it's an excellent view. The treatment is very fast. Actually, it's faster than regular PRP with pattern lasers, and we have done study and published on that. So that's where we are, and this is the study I mentioned by our collaborators in India, Dr. Chablani. What also happens when you look at the spots that you treat, the spots are more uniform, and it's probably because of the optics that is used for panretinal photocoagulation with navigated laser. Okay, not that it may matter clinically, but you are delivering more uniform spots. So this technology has also been used in other conditions such as vein occlusion, central serous chorioretinopathy, telangiectasia. There are ongoing studies to look into feeder vessel and how we can target that, because this is an ideal technology to track feeder vessel and use indocyanine green angiogram and import it into your unit. So that's a brief summary of what is available, what has been done. This technology has gone over evolution, and it's a wonderful piece of equipment that we can use now for multiple conditions. Thank you very much.